first thing that I want to accomplish is want to talk about how we can become more empowered in our healthcare, what that looks like. Second thing is introduce you to a concept called evidence-based practice. Evidence-based practice. So evidence-based practice is a way for us to assess how well an individual might do when they receive healthcare for their condition, regardless of what it is. And that leads to the third item, how to become a better healthcare consumer. Which is ultimately what we designed for our clinic. It's kind of the theme. So, and this is kind of one of the genesis. It was, I can remember the day very clearly. It was 2013, and as a physical therapist practicing for at that time almost 20 years, it was assumed that individuals with rotator cuff tears. I think you all might know what rotator cuff tears are. And usually, when you hear that, it's not good, right? It was assumed that all individuals with rotator cuff tears would probably require surgery. And that was believed within the medical community, it was believed among orthopedists, and it was even believed within physical therapists themselves. And then there was this major project that was published in the Journal of Elbow and Shoulder Surgery, and that's a top-notch orthopedic journal. And it said, hey, you know what? The outcomes for individuals who have full thickness tears in their shoulder muscles without traumatic event, which is most of the shoulder problems, is equally good with and without surgery. And that wasn't an opinion. That was based on a clinical trial that was done all across the U.S. In 5 different centers. I looked at that protocol, and it was very much not in line with what was being offered to individuals. Even my colleagues in my profession hadn't known about that. It was one of the first published studies in 2013. Again, that's nearly 10 years ago. And I thought to myself 2 things. Number 1, I need to change the way I communicate with my patients regarding this, right? Because it was different evidence than what we thought. Number 2, I thought this was going to transform the way physical therapists and healthcare in general approach shoulder problems. It didn't either, to be honest. And even now, to this day, that evidence, despite that being proven time and time again in different research and clinical applications, is not being followed. So that was one of my first inklings, thinking, something's not quite right here in healthcare. And so what I want to do is kind of present a couple of models as to how we as individuals who aren't in healthcare, or when we're seeking care, that we can kind of frame how we can become better healthcare consumers, ask better questions, and ultimately get better outcomes. I want to buttress that story with a couple other stories. I had an occupational therapy colleague who was a supervisor of mine who had a disc problem. And she went to a reputable clinic. One of her friends actually worked at that clinic. And she went for consult. She had the typical back pain, some pain down the leg. And her friend, on a side note, said, hey, you know what we do here? She said, there's a saying in the office, hurry up and have surgery before it changes. And there's kind of a joke amongst the staff there, and basically what it points to the fact that many individuals with problem back, even herniated discs, when left to their own, it resolves on their own. Not in all instances, but in many instances. I frankly didn't find that very funny, because obviously the implication is there's an overutilization of care, maybe some unnecessary surgeries that are being done. And that's one example, for instance, where having an understanding of how to be a better healthcare consumer may save individuals from unnecessary, costly, and risky care. I got to know a retired orthopedic surgeon who didn't have practicing rights anymore. He had a tight hip, comes to me and says, Eric, I want to work on this, but I think there's a bony problem in my hip. He couldn't order his own x-rays, so he had it ordered. He had a chance to review the results that were read by a radiologist, that are the specialists that tend to, in the medical community, read and interpret those results. Oftentimes the orthopedists will themselves. So of course, he got a copy of the original studies. He said to me, you know, I looked at my x-ray results for my hip and I thought, it's mild arthritis at best. The radiology report said moderate to severe arthritis. This was his words, not mine. I think the radiologists for years have been badgered so heavily by practitioners that they've decided just to quiesce and upgrade the findings of reports. There's another individual who left practice in a group practice. He was called into his office. He was actually the chief of staff for their practice group. And they called him in one day, and this was his story to me. He said, yeah, I was called in, and they said, hey, you know, your patients stay in the hospital the fewest amount of days. He's thinking, that's great. You order the fewest amount of tests and procedures. He's thinking to himself, that's great. I think you know where this story's going to go. Your patients have the least amount of medications. He's thinking to himself, that's great. They said, no, it isn't. It's not helping our numbers. He decided that day that he needed to change practice. So this is a very positive group. I'm not trying to, you know, downplay the skill and practice of practitioners in the area. I just want to give you some stories that point to the fact that as consumers, particularly as healthcare consumers, we need to improve our literacy. That's what today's discussion is about. Maybe we can go anywhere somewhere. That's kind of full.
Not the best whiteboard in the world.
I guess not. So we'll continue onwards. So, so structurally, the clinical encounters I think are problematic, right? Real short office visits lead to some basic problems that I think need to be considered. So when someone sees their healthcare provider, oftentimes there's a very short clinical history, hearing what's going on. If there's any examination, it's usually very quick, and there's a tendency to order tests. Does that sound common to anybody when they go see their provider? I mean, who thinks that their provider gives them suitable time when they go in for primary care visits or specialty visits? That's good. Oftentimes that's not the case, right? So when medical history is incomplete, when there's not suitable time for a clinical discussion, and when tests are ordered instead of for a fishing expedition as opposed to trying to decide what is an increased likelihood of problem or what is decreased likelihood of problem, there's more tests that are run that are necessary. Those extra tests oftentimes result in increased utilization at an unnecessary rate for surgery, injections, and that sort of thing. So one of the keys to helping with that is to find a way to slow that down as a healthcare consumer, and that's with this concept called evidence-based practice. I'm going to abbreviate it as evidence-based practice here. The center of it is the patient, the individual. So the patient preference and their attitude and their belief system and what they want to see happen is center. This is a three approach triangle, and the second one is, what is the skill of the practitioner? So what is the expertise and the skill of the practitioner? I do conservative care, I don't do surgical care, right? So I have an inherent bias in how I approach patients, and that's acknowledged. The third part of it is, what does the research say? Is there research that supports one way or another? Spelling's not so good today, but so what is the patient preference? What is the skill and opinion of the practitioner? And what does the research say? In the middle, when there's common agreement, chances are that that person's going to have a really good result. I think that makes sense, no? Right? So I have a question for you. The patient perspective of what to do for a given condition, what does that require?
Engagement, maybe their own research.
Engagement, their own research.
Willingness to, be proactive, work on a situation.
says anything when they get to the doctor's office.
The biggest thing is what they need is they need information about all their options, right? And that's where it requires some work, right, ahead of time, because unfortunately, in clinical encounters with biases of practitioners, you don't always get that, right? So to increase healthcare literacy, I think first of all, number one is to realize there is a model that when individuals understand their role in healthcare, that people get better outcomes, they're more satisfied. Showing up in the doctor's office without a list of questions, showing up without doing some research ahead of time really hamstrings someone. Because in the end then, everything gets heavy on the practitioner. I had another practitioner actually, someone that I talked to who is in primary care, I asked him, well, how do you keep up with research? He said, well, basically I read the reports of what is being offered to individuals when I send them to specialists. I thought to myself, well, how do we know that the practitioners we're sending them to are keeping up on evidence-based practice, right? Because it's not easy. Information changes readily. Does that make sense? So it's not the responsibility of the patient to do the research evidence, but they can do some preliminary backgrounds. Asking simple questions. Hey, you're recommending this? What other options are available? What if I do that? What are the risks? If we don't do it, what are the risks, right? If I recommend something and someone says to me, you know what? I'm not interested in that. I'm like, that's great. Here's what I need to do. I need to just let you know, hey, in my experience, my understanding of the research, if you do it, you'll have this result. If you don't do this, you might have this result. The choice is yours. Because I'm not about to interfere with that individual's perspective. So this concept of evidence-based practice, I think, can go a long way towards helping to improve the communication that we have with our healthcare workers, and then to bring that empowerment to us, right? So what's something else that we can do for improving our healthcare when we go to see a provider? I think the next thing is probably bring a wing person, right? Right? When we're seeking care for something, we have a whole set of ideas, concerns, worries, particularly in these worrisome things that are troubling, right? Those symptoms that might be related to big time issues, maybe concerning signs and symptoms of cancer, heart disease, that sort of thing, or neurological disease. Those are emotional heavy things, right? And because we're kind of in a state of concern and worry, we're not going to be able to sort through all those facts. So having a wing person there to help guide any questions, and then really not leaving that encounter until those questions are answered, right? Like, make them kick you out if your questions aren't answered, right?
Done that.
Right? Unfortunately, not every clinical encounter has the type of time that's necessary to discuss all the options, and that may not be appropriate for that encounter, but at least have an open discussion about, hey, these are my concerns. Have someone make sure that those concerns are addressed. I personally love it when family members, friends, whomever come to encounters that I have with patients. It's terrific. They bring up concepts and ideas. They help that person remind me, hey, maybe you want to think of this, right? Because one of the most challenging things is, hey, great, I'll look forward to seeing you whenever. I'm about ready to walk out, and then all of a sudden you get, oh yeah, by the way, I forgot to tell you about this, or I want to know about this. It's helpful to bring that all on the forefront right away. So, one more concept for becoming a good healthcare consumer is obviously knowing what sort of things you can bring to yourself to that encounter, right? In terms of being prepared for that encounter and being forthright, right? Being honest. Like, who here doesn't want to or wants to admit or not admit that they've done or not done certain things, right? Like, for instance, when they do surveys of what people consume, what people eat, the The best surveys don't ask people. They dig through their trash, right? Because who wants to admit they've got on a late night binges, right? So being forthright and forward with those encounters is really helpful. One of the things that I wanted to share with everyone today was a recent topic that I'm doing more in-depth discussions on, and that's, I think you all had a series of handouts, and one of them is tips for sleep. And I'm still in the process of studying this more in depth, and the research is pretty fascinating. And so are the clinical outcomes. So I had an opportunity to give a presentation entirely on sleep and ways to improve your sleep, and prepared this document, and certainly you can use this to your wishes. And I make it clear to people that, you know what, I'm not a big fan of all these either, right? Who wants to go to bed the same time every night, even on the weekends, right? Who wants to not have some access to some electronics up to bedtime and catch up on things on social media, the news, or our favorite websites, right? This is a series of tips that if you're interested in improving your health, this is foundational. For me as a physical therapist, doctor of physical therapy, I became acutely interested and felt the necessity to study it more in depth because of two research projects that I became aware of. One was in athletics, the amount of sleep that an athlete has is more important to whether or not they're going to injure themselves on the field than is the stress on the field. In other words, sleep deprivation is going to lead to a higher incidence of injury, more so than anything they can do in an athletic event.
So our Packers are sleep deprived?
It certainly looked like it over in Europe, didn't it?
Thought I'd get that out there.
Imagine the challenge, you know, to go to Europe and play, right? To go to England and play, sure, for sure, right?
How often do you have a patient, if you call them that, come in and talk about sleep as part of the issue, along with whatever else they're coming in to see? I guess my question is, you know, how often does it enter that conversation?
You know, it's interesting. Most individuals don't report that as a problem.
Really?
When in fact it is.
Because so many people have sleep issues. They say the whole country is like sleep deprived.
That's true, right?
Yeah.
So the first thing I want to, one of the first goals that I have for individuals is I'm working with them and I'll tell them, look, you know, if you're not able to lie on your side because your shoulder's jacked up, or you got this neck arm pain, like the first thing we need to do is calm that down so that you can get a good night's rest. Because if you don't have a good night's rest, your pain system's going to be all jacked up. You're not going to like yourself, and certainly those around you aren't going to like yourself. So let's see if we can calm this down. But most people actually, when they are sleep deprived, because of a musculoskeletal problem, knee pain, back pain, sciatica, neck pain, arm pain, shoulder pain, they usually don't bring it up real quickly, right? I got to admit, I bring it up because number one, I think we need to know more about that and bring awareness to it. But number two, I want some help. Like, I can't really cure people. I help facilitate natural healing processes. And if I can get their sleep, or understand where they're at their sleep and give them some cues, or have them reflect upon what they can do to improve their sleep pattern, then I have another ally to help in that recovery process. There are stages of sleep, non-REM sleep, that actually repair muscles, bones, and joints. And when we shorten the sleep time, we enter less episodes and less numbers of episodes within those sleep cycles of restorative sleep. So it is absolutely critical. Yes?
How much sleep should we get?
So typically 7 to 9 hours.
7 to 9? Oops.
And does that change with age or standard across the board for everybody?
So,
Like, when can I send my kids to bed? That's really all I wanna know.
yeah, that's interesting. So there's two aspects of it, right? So what we hear commonly from individuals as they get older, right? Like, I feel like I don't need much sleep, or I have a harder time sleeping, right? Or it's real common that you'll hear, hey, that time that I sleep is really short. Is that normal? Is that ideal? It may be normal, like real common, but it's not ideal. It is one of the most destructive things we can do for our attention and our memory to shorten up sleep cycles, right? Sleep does three things for the memory. Number one, it helps improve our short-term memory so that we can recall, but so that late night studying, we don't remember much. I think we all kind of know that from experience. Number two, it takes that short-term memory and pulls it into long-term memory, right? Number three, and this is really less understood and really less appreciated, is that it helps us forget. It helps us forget about the emotional challenges that we face and makes us less stress tolerant. So it does harm to our mental health status when we don't get enough sleep. So real commonly, if I look at the diagnostic lists of individuals over the age of 60, anxiety and depression is probably more prevalent even than younger populations. It's very common, it's not ideal.
You need too much sleep?
What's that?
Too much sleep is a thing or not really?
Too much sleep can be a thing. I think it's not that common, and it's not right. I mean, that can be associated with other features as well.
Sean, I tried that this summer. It worked out great for me.
He just woke up.
Yeah.
He's here.
I've seen him for 3 months.
Well, he was in the gym. He was sleeping.
I know where you are.
I'll say one more thing in terms of older adults. Three things that are becoming very clear in terms of the research, in terms of how to improve cognition and to stave off age-related and dementia-related issues. The first thing is sleep. Deprivation of sleep. You take a look at all those signs and symptoms, and that is what people express when they're experiencing symptoms of dementia. Number two is nutrition. Absolutely, that more wholesome nutrition, things that we read about, and sometimes this stuff sounds kind of trite, but there's been a tremendous amount of research done at the University of Wisconsin-Madison in this regard. It absolutely makes a difference. And no, typical American diets is not the ideal one, right? Number three is, of course, exercise. Exercise does a number of things, but all three of those things, right? You can think of sleep as a capacity to pay attention, make good emotional decisions, right? You can think of nutrition, and avoiding the pitfalls of poor nutrition as allowing you the energy capacity to be active while you're awake, so that it's easier to do that, right? I'm a physical therapist by training, right? You think, hey, I'd advocate exercise and activity first, right? So we're starting to rethink that, like restorative sleep, protect that sleep. Yes?
I just recently read a thing where as you age, you make less melatonin, your body makes less melatonin, so that it triggers less desire to sleep.
That's one of the pressures that can happen. That's a correlation, right? Guess what else reduces melatonin?
Alcohol? Just take a snap.
Yeah.
Oh, yeah, phones and that screen, yeah.
So for 2 nights, up to 2 nights after exposure to melatonin, into the time that you should be asleep, your melatonin levels drop by at least 30% for 2 days after the exposure. So that advice of getting away from those screens within an hour of bed, there's good reason for that.
So, one, I guess, where are you guys located at? And two, you have to have a referral. And then, I guess, what is expected, if you show up, as far as doing a consult or something?
So terrific. So we're about 1.5 miles west of Aurora Hospital on Highway 21 at the intersection of Leonard's Point and 21, right across the street from St. Paul's United Church Christ. And a physician referral is not required. Some insurances may require it. We'll help obtain that. What we do with folks is we're a direct access clinic in that 98% of our patients come to us directly through public engagement, through referrals of other patients that we see, and simply call our office and the ladies will guide you through the process. Once you come in, we do an assessment, let you know what your options are, let you know what you're on the lam for both time, effort, and money, and then you get to decide how you want to proceed.
Okay.
Does that answer your question?
No, it's good.
Perfect. All right. So, and I'm happy. Sleep is an engaging topic. I'm happy to answer any more questions or field any more questions on that. I just wanted to orient you to a couple things that you have here. We do a lot of public engagement. We're at the senior center. We're at events. We do in-house presentations on a wide variety of topics. I presented that sleep. I did a sleep presentation with the seniors, and we do more. We're planning on doing more and more of that. So if you want to hear about where we're at, certainly you can fill out that orange slip, and we can keep you informed of what we have coming up. You've got the sleep tips. Again, I sometimes run the risk of giving information to people. I don't know if people are interested in hearing about that. Not everybody wants to look at their habits. I'm look, if it's useful to you, great. It's a useful tool. I think it's worthwhile considering and reflecting upon what you do. I know it's changed the way that I've approached sleep myself. Number 3 is one of the ways we invite people to explore an option for themselves. We have what's called a discovery visit or golden ticket, which you can just use to come in to get a complimentary look for your particular problem, and that's in the envelope entitled A Gift of Health. And then I think there's a gold sheet that just has some comments from folks that we've worked with. So just orient you to what you have in front of you. Yes?
Have you done any research on narcolepsy at all pertaining to sleep and how that affects? Because I have narcolepsy, and so I'm just constantly tired 24/7 and fall asleep randomly. Have you done any research about that?
I have not, but what I'm really interested in is how do we have more energy and capacity throughout the day, right? So that when we do those obligatory things, at the end of the day, is it ideal to just kind of crash and say, whew, glad I got through that, right? Or at the end of the day after work and after managing family responsibilities, do we want to have some increased energy for personal pursuits, to be attentive and in full mind, body, and spirit, those that we love and care about? That's what I'm really passionate about. So I can point you to something that might offer some addition to that. Certainly, for a sleep challenge like that, pursue that, right? And pursue that from sleep specialists, right? I can tell you the sleep medications, although they're commonly prescribed, they offer some problems of their own, spoiler alert, and there's few sleep specialists, unfortunately. But there's one particular resource that might be worthwhile considering for someone like yourself. It's called Eat for Energy by Ari Whitten. It might offer some insights and ideas that expand the idea of how do we get better health and energy for our daily life, which would be pretty fascinating and maybe something of use for you. That's Ari Whitten, Eat for Energy.
Do the cultures that promote naps, do they do better?
That is interesting. Yes, they do. Right? Naps are actually a good thing. They're encouraged, not necessarily after mid-afternoon, but those cultures that do take that noonday siesta, that aren't influenced by artificial light to extend the day, It's phenomenal if you look at those, the research of those individuals who haven't been affected by modernity, basically. Absolutely, heart disease, cardiovascular disease, cancers, yes.
I'm a patient at Physical Achievement Center. And since I started going, I'm learning quite a bit. And I still, I think, have a lot to learn more about proprioception. First of all, I can finally say the word. I think I said that correct.
We did great.
And you've got an interesting machine at your facility, the Proprio 5000, right?
Mhm.
And isn't proprioception kind of a common problem with people that have joint replacements? Or not?
So proprio, for those of you that, for reference, so first of all, the proprio unit that we have is something that I had seen a number of years ago. We're finally in the position to get it. It's a balanced reactionary device. It's cool. And we're really delighted to have it because we think it can help individuals above and beyond basic treatment for their balance disturbances, whether it's related from some sort of injury, concussion, vertigo, just unsteadiness. Proprioception is the ability to feel your body and to adapt to it. And most individuals with persistent problems, whether it be back pain, knee pain, particularly ankle and foot pain, they typically have impaired balance. In other words, if they were to try to do some balance challenges on one foot versus the other, and they've had an old injury there, people don't recover naturally from those sort of things. They've got to restore their normal mobility, they've got to restore their normal strength, and the body's got to have the capacity to feel that joint, feel those tissues. So that's a big part of recovery, is getting that to complete the cycle, because we just don't tell our body parts what to do. Our body parts are sending us information, and our brain needs to make sense of all that. So, yeah, that's a big thing. So I'm proud of you for saying proprioception properly. That's awesome. It's a fun device. I always say to my folks, we got really fantastic balance recovery exercises. They're all boring as heck. So two things that really excite me about balance. One is the Proprio 3000 unit that we got in, and the other is we hope to get this program up and running pretty soon called Ballroom Dance for Balance. Which is just, I mean, you just hear the title, you're like, that just sounds great. I'm not a big dancer, and I've got 2 left feet, and I never laughed so much during a training in my life. So we're looking forward to bring that to the community, hopefully this winter yet. So I've got some dancers in the community who are hopefully going to help us with that. And just like, you had the students here coming in, it was great. I mean, talk about a nerve-wracking experience, right? They knocked it out of the park, but to have that intergenerational interaction, so these programs oftentimes bring in students from younger generations, maybe help some folks who have some balance troubles, and have a different kind of context of engagement. So we're hoping to get that up and running real soon. And I can learn some basic moves. That's great.